University of Virginia Medical Center has a new mobile mammography coach with a memorable paint job. Look at that. And Tracy Gosse is here from the Breast Care Center to talk about that and other services the center offers. And so, first question out, when we're talking about breast care, a lot of women know, to check themselves. How much is it preventive breast care?
It is very preventative at this point, and it's really crucial that women, especially between the ages of 40 and 64, are performing their monthly breast self-examinations. They should also be getting yearly mammograms as well, screening mammograms, to ensure that there's no area of concern for anyone. If they have any strong family history of breast cancer, then those ages could begin a little sooner and end a little longer.
Right, they need to be especially careful. Even a weekly self-exam is not, crazy to think about doing. So if doctors do find something, say the mammogram comes back and they see something, what happens then?
So if the original mammogram was performed in a 2D technology, then we would go ahead and repeat that mammogram using 3D technology, which most of our sites have and our mobile unit has. We would also use something called contrast-enhanced spectral mammography, where a dye is introduced into the vein. Both of those technologies let our 4 dedicated radiologists at our breast care center read that image much more clearly than they can in a 2D. That way, if they find anything that's concerning, we can look at biopsying that area. Once the biopsy is performed by one of our radiologists, we send that off to the lab, and then the results that come back would indicate the next steps for the patient, be it surgery or a referral to one of our high-risk clinic members.
Sure, and there is a difference between dense breast tissue and what you should do if you're told that you have dense breast tissue.
Correct. And so for us, when we perform mammograms and we notice that a patient has dense breast tissue, we send out a letter to them letting them know that that's what we've determined, that they have dense breast tissue. 3D mammography is probably a better way for them to go, just to ensure that they're not missing anything for them, and that contrast-enhanced spectral mammography would also help in those situations.
It just shows so much more.
Absolutely.
The doctors to look at. So how does UVA manage this breast cancer treatment? Because, I mean, it could be different for everyone, just depending on their situation.
Absolutely.
Correct?
It is, and I think the treatments become very overwhelming for the patients as well as their family members. So we do have a nurse navigator on site who's there to help guide our patients through all of the phases of their care and all of their treatment that they might receive with us at UVA. That could be surgery, that could be chemotherapy or radiation therapy. We have nurse coordinators that work with those groups as well. We also have many clinical trials that we participate in, so nurses are there to help them with that as well. So there's always somebody along each step of the way with the patient, giving them a very personalized care plan.
So much information. All right, Tracy, thanks so much for coming here
me.
today. We really appreciate it.
Thank you.